health experts say the Ebola outbreak has led to less focus on other very important health issues in the countries affected by the outbreak. The World Health Organization says there is a growing risk of measles, pertussis, and other vaccine-preventable diseases in Guinea, Liberia, and Sierra Leone, the three countries most affected by Ebola epidemic. The WHO says the threat must be countered by urgently increasing scaling routine immunization activities. Dr. Edward Kelly, the WHO Director for Service Delivery and Safety, explains why it's important to keep a close eye on diseases other than Ebola.
Currently, the guidance for WHO is to recommend mass vaccination only in districts that are Ebola-free and to strengthen routine immunization in districts that still have active Ebola cases.
During the Ebola outbreak, people infected with diseases such as malaria and typhoid have been unable to get treatment. They have been either too afraid to seek help at health centers or because such facilities have been closed. Dr. Kelly says the Ebola treatment units could help.
Now we've gotten to the point where almost 100% of these Ebola treatment units are really meeting standards and delivering safe care to patients. But if you go across the street, you go into the next village, these facilities only have about 40% of what they need. In some districts, 60% of the facilities don't even have running clean water. So it's very difficult to provide safe care to patients in those situations, and clearly means we have a long way to go to strengthening these health systems over the long term.
Medical observers say the Ebola outbreak, which was declared in West Africa last year, has affected countries with already weak health systems.
Clearly, health systems recovery needs to be based on a few priorities, and these would be, like we've said, vaccination. It would also be around establishing safe essential services, especially for at-risk mothers and children, and it would be around strengthening infection prevention and control in all healthcare facilities.
The epidemic has also reduced vaccination coverage in Guinea, Liberia, and Sierra Leone as health facilities and staff focus on halting the outbreak. About 24,000 people have been infected and more than 10,000 people died. Now joining us live via Skype from Santa Barbara, California, for more on the subject is Andrew MacCalla, Director of International Programs and Emergency Response with Direct Relief. Mr. MacCalla, welcome to Africa 54.
Thanks for having me.
Actually, you just returned from West Africa, where you were in Liberia and Sierra Leone. Can you give us a sense of the update? What did you see as of now? What can you tell us?
Yes, I just returned a few weeks ago from both countries, spent a few weeks there. And, you know, the things we saw were in some ways very encouraging. I think the Ministry of Health and the governments have done a great deal to stem the tide of Ebola. You know, everywhere we went, we were getting our temperatures monitored before entering a new town or going into an office building. You'd get monitored. The Ebola care centers have been set up to triage patients, and, you know, everyone in these countries is really an Ebola fighter. Every person, every shopkeeper, every, you know, student who knows about Ebola now, they're being very vigilant in knowing how to kind of prevent and stop the spread. So in some ways it was very encouraging. In other ways, I'd have to say discouraging in that there were still spikes in cases. Actually, when we left Liberia, they had released the last case they had in an Ebola treatment unit, only to find a couple weeks later there was a new case and thousands of new contacts. So the fight's definitely not over, but we saw some encouraging things.
Okay. So clearly the threat is still there, the outbreak is still ongoing, even though it has decreased. We saw in the report that the WHO representative was talking about the need to strengthen health system. Direct Relief has actually shifted its focus now on doing so. Can you tell us what it entails in terms of what you are doing on the ground?
Yeah, the health system, as your earlier report mentioned, I mean, being weak, there has been a great deal of other kind of side effects of this Ebola outbreak. These health systems were already extremely weak. You know, it's pretty well talked about the low number of healthcare workers that are in these countries, the low number of doctors. And so they're already very destabilized health systems. And when Ebola comes and everything is directed towards Ebola, because it has to be naturally, there's all the other things that are kind of left, unfortunately, by the wayside. So you've seen a measles outbreaks, you've seen moms having to deliver babies at home because they couldn't go to hospitals or clinics to deliver babies. Health workers weren't going into work, were on strike, and you've seen a really lack of confidence in the healthcare system, both on the patient side and on the medical provider side. So what Direct Relief is trying to do is really provide those essential materials back into the healthcare system so that doctors and nurses have the supplies and equipment and personal protection they need to do their job. And so that once the patients see these doctors and nurses are back, hopefully the confidence will be built back up in the health system, and folks who are, you know, dealing with other things that are not Ebola related can get care.
Okay, Mr. MacCalla, we have to leave it there. Thank you so much for joining us today. And that was Andrew MacCalla, Director of International Programs and Emergency Response with Direct Relief. And that's our Africa Health Report for today. Back to you, Vincent.
Well, Linord, thanks, and be sure to check out Linord Moudou's health reports every Tuesday and Thursday right here on Africa 54.